If you are living with pain, but all your scans and tests keep coming back clear, you might want to listen to this. You might not have structural damage. You might have what's called neuroplastic pain. In this video, I'll explain what neuroplastic pain means, how it's different from pain caused by ongoing injury, and how you can begin to recognize whether your symptoms might fall into that category. I've also linked a simple self-assessment quiz below. It combines a few evidence-based tools to help you get a clearer picture of what might be happening in your system beneath the surface. So, neuroplastic pain, sometimes called nociplastic pain, happens when the brain keeps sending pain signals even after the original injury or threat has passed. It's not all in your head, of course. The pain is very, very real, but it's generated by brain pathways that have become overprotective. Neuroplasticity, which is the brain's ability to form new connections, is the same process that once learned pain. And it's also what allows your brain to unlearn it. And that's the good news. But let's look at 4 signs that your pain or symptoms might be neuroplastic rather than caused by injury. The first thing to explore is adverse childhood experiences, or ACEs. These include things like emotional neglect, physical or emotional abuse, exposure to addiction or domestic conflict, and other forms of early stress or trauma. But your childhood might have felt quite normal. Still, I'd like you to consider subtler experiences. Maybe you moved house often and felt unsettled. Perhaps a parent shared their problems with you and you felt responsible for their emotions or emotional well-being. Or maybe you have learned that keeping everyone happy, perhaps cleaning the house, making dinner, being the good one, kept things calm in your household. All of these experiences can quietly teach a child's nervous system to stay alert for danger or disapproval. So adaptation begins and we carry them for the rest of our life, even when those behaviors or emotions are no longer needed. Anyway, research shows that people with higher ACE scores are more likely to experience chronic pain, fatigue, or stress-related symptoms later in life. So I have created that simple quiz I mentioned before that merges this ACE questionnaire with the next 3 signs we'll talk about. You'll find it linked below again. But stay with me until the end if you want to have a clear view of your pain or even fatigue patterns. It's not much different. If your score is 0, anyway, there is a lower likelihood your pain is linked to stress or trauma patterns. If the score is higher, it doesn't diagnose anything, it simply suggests your nervous system might have been shaped by earlier stress and could now be expressing that through pain or fatigue. You'll understand more when I talk about the nervous system states. The second sign comes from Dr. Howard Schubiner's work, the FIT model, which stands for functional, inconsistent, and triggered. Functional means the symptoms affect the function of an area, not its structure. The tissues themselves are healthy, but the brain and nervous system keep sending those pain signals even though the body has healed. For example, You might feel a sharp twinge in your back when lifting a kettle, even though there is no injury there or damage. Or pain might linger a year or more after an injury that should have healed within weeks or months. I haven't said that very well. This happens because the pain signal has become learned. It's being maintained by the brain's protective wiring, not by structural damage. And since MRIs are very sensitive, they often pick up normal age-related changes that look worrying, but aren't actually causing pain. And there is research around that, and I've linked a study below. Inconsistent means that it changes. Maybe it moves from your back to your hip, flares up on some days and not others, or feels worse when you're stressed, but fine when you are distracted, maybe with your favorite hobby, or having fun with friends, or when you are on holiday. Triggered means that pain shows up in specific contexts. For example, after a stressful conversation, on Sunday nights before work, or when you smell a hospital corridor that reminds your brain of injury. These patterns often point to a nervous system misfiring protective signals rather than ongoing damage, so physical damage. Again, this doesn't replace a medical assessment, but if your symptoms fit several of these categories, it's worth exploring the neuroplastic perspective. The third sign involves looking at where your nervous system tends to live. And again, this is influenced by childhood experiences as well. Are you mostly in that just right zone, calm, curious, connected, able to rest and focus? Think of moments like walking outdoors, laughing with a friend, or reading without tension in your shoulders. Or do you often feel wired, restless, anxious, alert, your mind racing at night? That's the fight or flight state. Or maybe you swing between high alert and exhaustion, pushing hard, then crashing. I'm quite familiar with that. I will tell you more later. And sometimes people experience shutdown or hyperarousal. That's when you're feeling really flat, spaced out, disconnected or heavy, like your system has hit power saving mode. Hey Nula! These patterns are part of the body's protection system. Chronic stress can keep you stuck in them, and pain can become woven into that loop. So, the nervous system state checklist is again within that resource I mentioned earlier. And that will help you notice which state feels most familiar. Pain and stress aren't separate. They are two languages your nervous system uses to say, I don't feel safe. The fourth sign is about personality patterns. Many people with neuroplastic pain share certain traits. Putting too much pressure on themselves, perfectionism, self-criticism or over-responsibility, constant worrying, caring deeply for others but forgetting their own needs or boundaries. I know this one personally. So during my PhD, I had a glorious combination of perfectionism and fear of failure. Of course, why not? I coped by bouncing between procrastination for months and months and hyper-focus for a few months, working long hours, skipping meals, pushing through to finish that dissertation and make it perfect. My brain decided the best way to get my attention was a symphony of chest pain, shoulder pain, neck pain. It worked rather well. But that's how I became an expert in this area of work. These traits aren't flaws. They began as survival strategies to help us feel safe and accepted. See the connection with childhood experiences. But over time, living in that do more, be better mode keeps the nervous system in constant alert, feeding cycles of tension, pain, and fatigue. If any of these sounds familiar, please don't turn it into another reason for self-criticism. This is simply information. Your body-mind saying it's time for being gentle with yourself. So, the 4 signs we have covered. 1. Adverse childhood experiences. 2. The fit model. 3. Your nervous system state. 4. Personality tendencies. Each one offers a clue about what your pain might be communicating. They are all connected. Remember that none of them replace medical diagnosis, but together they help you see the whole system, the biopsychosocial side of pain, especially when the scans are clear. So, healing needs to be holistic too. Not just treating what shows up on an X-ray, but addressing the emotional, psychological, and nervous system layers underneath. If going to the physio or for a massage makes you feel better, but symptoms bounce back after a few days or a few hours, this is an important cue. As I said earlier, you'll find the link to the combined self-assessment quiz below this video. And if you want to learn more, there is another video here on the channel that explains what neuroplastic pain is and how to treat it. Just gives you a little bit of a different angle. For now, thank you for watching, and before you scroll away, just take a slow breath in and notice your exhale. Maybe place a hand or both on your chest and let your shoulders soften. Can you find a place in your body where that exhale feels comfortable or soothing? That's your first small message of safety to your system. So I will see you in the next video, and don't forget to drop a like if you haven't enjoyed this one. Thank you for watching.